Now I'm happy to introduce our next speaker, Eric Breton, who is president of the EUPHA Health Promotion Section and professor at the EHESP, the French School of Public Health in Rennes. And Eric, you will speak about the role of community health workers in building bridges and improving community health literacy. The floor is yours.
With the mic on is always better. Thank you so much. I'm very pleased to be here today. And I'd like to thank, of course, the UNESCO chair for inviting me and for also the EUPHA. So I'm sharing my screen. You should be seeing it now, if I'm not wrong. Let me know if there's
fine. It's no problem. Great.
Okay, very well. So I'd like also to thank my colleagues who actually contributed to the studies we conducted on local health contracts. That will be the topic I'll address today. And so basically the life course perspective, as you know, is a very hard nut to crack. It can have many meanings, but in public health perspective, it often entails the idea of not restricting our focus to a single age group. In fact, when we take a step back from our focus on specific age groups or population subgroups, what basically unites us as children or parents, grandparents, neighbor, whoever, is more or less a shared experience of daily living conditions. So in other words, when we think of it, so children, and for instance, children cannot live happy lives, happy and fulfilling lives if their parents are struggling on a daily basis with issues such as poor housings, low wages, precarious employment status, and discrimination. And so, sorry, I'm trying to, improving daily living conditions is therefore an important entry door for life course perspective. It is also a central leverage point to reduce inequities in health. This is one of the core messages of the 2008 WHO Commission on the Social Determinants of Health. So the commissioner's message was very clear. And I mean, 2008 is a bit far back, but the message is still crucially important. So there will be no significant reduction in inequity in health within and between countries without improvement in daily living conditions. So this brings us to consider what exactly makes these daily living conditions bad for our health and central drivers of inequalities. So we know from decades of research on health inequalities that living conditions are associated with level of resources, opportunities, and different resources, exposures to environmental risk factors. So poor living conditions, such as the ones related to housing or employment, are also a source of stress and shames that wear us out. This is basically new perspective on inequalities. So this is where the issue of breaking silos come into play. Improving daily living conditions cannot be achieved through the action of a single sector of society. So improving housing or work conditions or providing secure environment for our children and adolescents are actually extremely complex enterprises. So breaking silos calls for joinous governance, and it's something that has been repeatedly and continuously called for in public health literature, but it's still something that many wonder how to do, how we can do it, basically. So I want to share with you the experience of France in developing at the local level some kind of health and all policies instruments, and that example is showing some benefits. So in France, the Health Act of 2009 introduced the possibility for regional health agencies to sign agreements with local governments. that set a number of objectives to improve population health and equity. So the agreements are known as local health contracts, and they cover actions in the field of prevention, health promotion, environmental health, and access to healthcare. So what is very interesting with this new legislation is that it did not say anything more than local government could engage in actions in those areas. So it means that it has left local governments much leeway to engage in actions that closely fit with their circumstances. So they were able to adapt the policy to their context. So at the core of the local health contracts, there are community health workers that are managing all the activities. So their missions are extremely broad, I would say, as they cover population needs assessment. They mobilize local partners, they define the actions, they support their partners for their implementation, and they also conduct evaluations. So that's quite I'd say a job, a workload. So as we can see here from our National Survey of Local Health Contracts, basically those contracts, they address a very broad range of public health problems. There's just part of them. We look at environmental health topics. They also address many of those topics. So what do we know about the benefits associated with local health contracts? Basically, we know that they produce new actions on the territory. We know that actually those actions are more better integrated in the context of the local community. We see that basically the elected officials who used to be very much focused on access to healthcare services, because we have many territories where there are some kind of medical desert, we call it. So there's no GPs and a lack of GPs and health professionals. So basically the local health contracts add them to actually broaden up their perspective on health. We saw that in contracts, even though they sign at the start of a contract that may be a 5-year-long contract, they sign for a list of actions. What we say is that basically over the duration of the contracts, they develop new initiatives that were not planned. So that shows that basically they can adapt to changing contexts of the territory. They are able to overcome those silos in some ways. And the last one is basically they can actually, I'll use the next slide to explain. We've seen all those topics they address, but actually it's what is not seen, what we saw behind those activities is the fact that we have actions that used to be just on one topic or one problem, that actually when you break down silos, you have partners from different fields that basically collaborate. So as you can see, if you have only nutritionists working on that topic, what we'll get at school are basically education sessions. It's more, they can do much more than that, of course, but typically they will focus on basically education. If you have a nutritionist working with environmentalists, what you'll do is you're opening up a realm of possibilities. And we've seen that, we saw evidence of that in many of the descriptions of the actions that were actually implemented over the country. Okay, so now I'd like to conclude my talk basically with the idea of health literacy. So of course I cannot do as well as Catherine Jenkins just did, but I'd like to say that just to build on what she presented, that was very interesting, especially the library stuff. So just to build on what she said, and to say that health literacy can also be an instrument to improve intersectoral action. So we do agree on that. So we need to basically recognize that unequal distribution of power is a key issue when a local community tries to improve its daily living conditions. Agriculture, so farmers do have some leverage with their tractors, as Charlotte Marchandise mentioned early on from the presentation. So if you take, for instance, regional housing policies, so you see that authorities and elected officials, they will often tell you that they're doing their best to improve housing, but cannot do more, even though people are struggling to find proper housing. So yet at the same time, you see the same people that may actually invest a lot of resources on other projects that are far less impactful on people's life. So we need to recognize the importance for local population to not only be health literate about the determinants of their own health, and to know that what is a proper diet, what is, how to access healthcare services, all those determinants. We need also communities to be health literate. And those communities to be health literate means that they can actually engage in the policy process and implement advocacy strategies that may help them actually have their voices heard and their needs accounted for. So they need to be able, basically, to occupy policy spaces where they are not seen as entitled to be or to belong. And this is a clear characteristic of power relationship. I mean, we have basically vulnerable groups that will never be invited to actually provide, to have their voices heard. So to conclude, basically, so community health workers, when enabled to do so, they can be really instrumental, not only in breaking silos, but also in contributing to improve the community health literacy. And this will enable people to address some of the upstream determinants of their health. Thank you very much for listening.